Bismillahirrahmanirrahim. In this video, we'll discuss how to manage new oral anticoagulant in perioperative setting in one-page approach. And as usual, we start by the general scheme of management of these patients. The management of new oral anticoagulant in the perioperative settings is depend on the type of drugs and the type of surgery. It, for example, we start by if this patient have an epic-span or rivaroxaban or redoxaban, and this patient have a low or moderate bleeding risk, the drug will be interrupted 24 hours before operations and restart the drugs 24 hours after operations. If the bleeding risk of the surgery is high, we'll interrupt the drug 48 hours before operations and restart the drug 48 to 72 hours after the operations. But if the patient on dabigatran, we'll check two risk factors, the creatinine clearance and the type of surgery. So if the creatinine clearance more than 50, the drugs will be managed as before, like a span or a span. Will the bleeding risk is low or moderate, will interrupt 24 hours before operation. If high bleeding risk, and interrupt 48 hours before operations. And in both cases, will start 24 or 48 hours after operations. But if the creatinine clearance less than 50 milliliter per minute and the patient have a low bleeding risk, low or moderate bleeding risk, we interrupt the drug 48 before operations, hours before operations, and restart 24 hours after operations. But in high bleeding risk of surgery, we interrupt the drugs 4 days before operations and restart 48 to 72 hours after operations. As we notice here, there's no bridging in new oral anticoagulants, so we don't need to assess the risk of the thrombosis as we discussed before in patient on vitamin K antagonist. So as we mentioned before, the bleeding risk can be categorized into minimal, low or moderate or high, depend on the risk of the bleeding of surgery. For example, the patient on cataract or minor dental extraction, this is a minor bleeding risk. Patient lab cholecystectomy or patient have a colonoscopy with biopsy is low to moderate bleeding risk. Any type of surgery that major thoracic or abdominal is a high bleeding risk. Let us take some examples. We have 65 years old male patients on epixaban, creatinine 1 milligram per deciliters and undergoing lab cholecystectomy. This patient has a moderate bleeding risk. Moderate bleeding risk to discontinue epixaban 24 hours before operations and restart the drugs 24 hours after operations. The second examples, 35 years old male patient in rivaroxaban, creatinine 1 milligram per deciliter and undergoing pancreatic tumors. So this patient have a high bleeding risk, so we'll discontinue, this is the drug here, we'll discontinue 48 hours before operation and restart the drug 48 to 72 hours after operations. The third example, 70 years old male patient on dabigatran, creatinine is 2 milligram per deciliter and expected creatinine clearance will be less than 50 milliliter per minute and undergoing spine surgery. So this patient has a high bleeding risk, and because the creatinine clearance less than 50, this patient will be, the dabigatran will be discontinued 48 hours before operations, 4 days before operations, and will restart the dabigatran 48 to 72 hours after operation. And for further details, you can check the guideline that recently published in CHEST 2022. Thank you.